everyone. Thank you so much. So today my topic is going to continue on hepatitis. Last week I started this topic. I spoke on hepatitis A. And so today I'm going to pick back up, just give you a little review on that and then continue for hepatitis B. So key points to remember about hepatitis A. The prognosis for hepatitis A patients is excellent, with self-limiting course and recovery is complete. The disease does not become chronic and there are no longer health implications. Hepatitis A is preventable by vaccine. It spreads from contaminated food or water or contact with someone who's infected. The condition clears up on its own in 1 to 2 months. Rest and adequate hydration can help. So let's talk about hepatitis B and its transmission. So hepatitis B can be transmitted through exposure to contaminated blood, needles, syringes, or bodily fluids, including saliva, semen, or vaginal secretion, as well as from mother to baby. It is a chronic disorder and in some cases may lead to long-term liver damage, liver cancer, and cirrhosis of the liver after many years of carrying the virus. Types of hepatitis B. There are 2 types of hepatitis infections. There's an acute infection and there's a chronic infection. When a person has the acute infection, is first infected with hepatitis B, it is called the acute infection. Symptoms range from no symptoms to liver failure. Usually adults recover from this and have no further problems. Chronic infection, and the virus, if the virus remains in the blood for more than 6 months, then it's considered a chronic infection. While most adults do not develop chronic hepatitis B, infants and young children are less able to rid their bodies of the virus and may develop chronic hepatitis B as a result. Those with chronic hepatitis B infection are at an increased risk for developing liver cancer. If someone has chronic hepatitis B infection, their doctor will monitor them closely with surveillance imaging every 6 months. This is what a healthy liver looks like. This is what an inflamed liver looks like during the hepatitis. Hepatitis B symptoms. Hepatitis B may develop without any signs or symptoms may be nonspecific and short-lived. There are 3 phases. The acute phase, so acute hepatitis B infection, and symptoms may differ depending on the stage. Early in the disease, called the prodromal phase, symptoms may include fever, joint pain or arthritis, rash, edema, which is swelling. Symptoms of the next phase, which is the preteric phase, include fatigue, malaise, muscle pain, anorexia, nausea and or vomiting, fever, cough, abdominal pain or diarrhea, dark urine, and light colored stool. During the ecteric phase, jaundice, which is yellow of the skin, the whites of the eyes, develops. Anorexia also happens. Nausea and vomiting may worsen. Irritated skin lesions may develop, and other symptoms may subside. Chronic hepatitis B symptoms. Most people with chronic hepatitis B are asymptomatic, as I discussed. Others might have non-specific symptoms and the fatigue. And this is a picture of that. Some people may have ascites as well, which is fluid retention in the abdomen, peripheral edema, which I already spoke of, and encephalopathy, I'm tired from last night, when the liver isn't functioning well. It can't clear toxins from the body. These toxins build up in the blood and affect the brain function, leading to confusion. The diagnosis. Hepatitis B diagnosis begins by conducting a thorough physical examination, during which persons describe their symptoms and medical history. So it's important that we're documenting what we're feeling, how you're feeling. If you have a loved one, that you know what those symptoms are. Other procedures used to diagnose hepatitis B, the doctors could also use diagnostic tests, liver biopsy, blood tests, just to name a few. MRI also can be done, as well as ultrasound. Treatment for hepatitis B. Acute hepatitis B usually resolves on its own, as I stated earlier, without any intervention. Treatment from chronic hepatitis B includes medications to suppress the virus and reduce the risk of long-term medical complications. So some of the 10 best foods to cleanse your liver. Olive oil is very good. Lemon juice, leafy greens, avocado, green tea, carrots, beets, turmeric, garlic, spinach, if you're able to tolerate them. Some diet plan for hepatitis B patients. Food can include the steamed green leafy vegetables, fish, fresh fruits, fresh vegetable juices, organic chicken, plenty of drinking water, and whole grains. Blueberries are good and all those things. So just keep an eye on that. Hepatitis B prevention. There are a number of ways to protect against hepatitis B virus. Hepatitis B immune globulin. This is an injection that someone can get if they were in close contact with someone who's infected with hepatitis B. Hepatitis B vaccine. Here in the United States, this vaccine is often given at birth and is part of the standard immunization schedule. The vaccine is also recommended for those in high-risk groups, including newborns, children, and adolescents that are not vaccinated at birth. Those who work or live in a center for people who are developmentally disabled, people who live with someone who has hepatitis B, healthcare workers, emergency workers, and other people who come into contact with blood. Anyone who has a sexually transmitted infection, including HIV, men who have sex with other men, people who have multiple sexual partners of someone who has hepatitis B, people who inject illegal drugs or shear needles and syringes, people with chronic liver disease, people with end-stage kidney disease, travelers planning to go to an area of the world with high hepatitis B infection rate. Be cautious about body piercing and tattoos. Make sure you're asking, if you're going for tattoos, which I don't recommend, how the equipments are clean. That's very important as well. Pregnant women are screened for the presence of this antigen as well. Let's talk about it when someone is pregnant. Because their immune system aren't fully developed, infants and young children are more likely to develop chronic hepatitis B. So it's important to limit their exposure to the virus. All expecting women should be screened for hepatitis B. If a high viral load is detected through testing, your doctor will initiate treatment during the 3rd trimester to reduce the likelihood that your baby will contract the disease during delivery as they pass through your vaginal canal. Additionally, the infants of mothers with hepatitis B should receive the hepatitis B vaccination series and immune globulins at birth so they do not develop hepatitis B. Every individual must know if you know you've been exposed to hepatitis B, contact your healthcare provider immediately. A preventative treatment may reduce your risk of infection if you receive the treatment within 24 hours of exposure to the virus. There's also medication, and in some cases, people have to get liver transplant as well. Having chronic hepatitis B virus infection can lead to serious complications such as scarring of the liver, cirrhosis, liver cancer, liver failure, reactivation of the hepatitis B virus. Other conditions, people with chronic hepatitis B may develop kidney disease or inflammation of blood vessels. 5 must-know things about hepatitis A, B, and I'm going to add C in there as well. Hepatitis A, how does it spread? Through food or water that has been contaminated by fecal matter. Is it vaccine preventable? Yes. Hepatitis B is spread through blood and body fluids. Is there a vaccine to prevent it? Yes, there is. Hepatitis C, which I'll touch on more next week. How is it spread? Direct blood contact. Is there a vaccine to prevent this? No. Next Sunday, my topic will be on hepatitis C and D. I hope this was helpful. Please join me in the Zoom room right after the service. You can ask me any questions. I'll be happy to answer them for you. God bless you. Thank you and enjoy the rest of the service.